Good day, everyone. I am the antiemetic agent Nabilone. My generic name is Nabilone. My brand name is the one and only Sisamet. And my chemical name is here. Now, let's talk about my drug classification. My pharmacologic drug classification is antiemetics. Next, we'll talk about my pregnancy category. I am categorized as pregnancy category C. Now, let's talk about my mechanism of action. I am an orally active synthetic cannabinoid which, like other cannabinoids, has complex effects on the central nervous system. It has been suggested that the antiemetic effects of Nabilone is caused by interaction with the cannabinoid receptor system. Example of this is the CB1 receptor, which is a compound of the endocannabinoid system of the body. The endocannabinoid system is widely distributed throughout the central and peripheral nervous system via the cannabinoid receptors CB1 and CB2 and plays a role in many physiological processes such as inflammation, cardiovascular function, learning, pain, memory, stress and emotional regulation, and the sleep or wake cycle, among many others. CB1 receptors are found in both the central and peripheral nervous system and are most abundant in the hippocampus and amygdala, which are the areas of the brain responsible for short-term memory storage and emotional regulation. CB2 receptors are mainly located in the peripheral nervous system and can be found on lymphoid tissues where they are involved in regulation of immune function. Now, let's talk about my pharmacokinetics. First is the absorption. Nabilone is absorbed rapid and complete. Nabilone appears to be completely absorbed from the human gastrointestinal tract when administered orally. Following oral administration of a 2 mg dose of radiolabeled Nabilone, peak plasma concentrations of approximately 2 ng per ml Nabilone and 10 ng equivalents per ml total radioactivity are achieved within 2 hours. In distribution, it is distributed up to 12.5 liters per kilogram. In metabolism, it is extensively metabolized to several active metabolites by oxidation and stereospecific enzyme reduction. CYP450 enzymes may also be involved. In the hepatic system, 2 metabolic pathways have been suggested. The major pathway probably involves the direct oxidation of Nabilone to produce hydroxylic and carboxylic analogs. These compounds are thought to account for the remaining plasma radioactivity when carbonyl metabolites have been extracted. In excretion, feces are about 60% and urine is up to 24%. The time of peak in serum is within 2 hours. Half-life elimination for parent compound is up to 2 hours. Metabolites until 35 hours. Now, let's talk about my indications. Nausea and vomiting or refractory. Is treatment of refractory nausea and vomiting associated with cancer chemotherapy in patients who have failed to adequately respond to conventional antiemetic regimens. This limited of use due to disturbing cytotomimetic reactions not observed with other antiemetic agents. Nabilone should only be used for refractory nausea and vomiting. Nabilone is also intended for use under close supervision, particularly during initial use and with dose adjustments. Nabilone is a Schedule II controlled substance. Schedule II substances have a high potential for abuse. Limit prescriptions to the amount necessary for a single chemotherapy cycle or in a few days. Nabilone is also not intended to be used on as needed basis or as an initial antiemetic agent. Monitor patients receiving Nabilone for signs of excessive use, abuse, and misuse. Patients who may be at risk for substance abuse include those with personal or family history of substance abuse, including drug or alcohol abuse or mental illness.
Contraindications, side and adverse effects, and the nursing interventions of the drug Nabilone. Contraindications: angina, cardiac arrhythmias, cardiac disease, coronary artery disease, hypertension, orthostatic hypotension. In patients with heart disease, the risk versus benefits of Nabilone therapy should be considered and carefully. Nabilone stimulates the function of sympathomimetics and has been shown to induce tachycardia. Bipolar disorder, depression, mania, psychosis, and schizophrenia. Psychotoxic effects can be produced by Nabilone, and psychiatric conditions can be intensified, including depression, schizophrenia, mania, psychosis, and bipolar disorder. After its oral administration, the effects of Nabilone can persist for a variable and unpredictable period of time. After cessation of treatment, adverse psychiatric reactions will continue for 40 to 72 hours. During Nabilone treatment, careful psychiatric monitoring for these patients is recommended. Driving operating machinery. Nabilone patients should be cautioned against driving or operating machinery or performing any risky operation before it is known that they can handle the medication and perform those activities safely. It is also important to alert patients of potential mood changes and other adverse behavioral effects of the drug. During the initial use of Nabilone and after those changes, patients should remain under the control of a responsible adult. Alcoholism, substance abuse. Nabilone should be prescribed with caution to patients who are considered to have a history of substance abuse, including alcoholism, since they may be more likely to abuse the medication. Nabilone contains an active compound similar to marijuana. Nabilone can produce subjective side effects that can be perceived at therapeutic doses, as euphoria or marijuana-like high. At this time, the physical dependency potential of Nabilone is uncertain. There was no indication of withdrawal symptoms after the cessation of Nabilone in patients who participated in clinical trial for up to 5 days. Hepatic disease, renal failure, and renal impairment. Cautious use in patients with renal disease, including impaired renal function or renal failure, or hepatic disease. Although the safety of Nabilone administration has not been studied in these populations, Nabilone is easily metabolized by the liver, and hepatic disease patients may experience delayed drug clearance and may be at higher risk of drug accumulation and toxicity. When starting a modified Nabilone therapy in the presence of liver dysfunction, use for caution. Geriatric. In general, the choice of geriatric patients' dosage should be prudent, typically beginning at the low end of the dosing spectrum, indicating a higher frequency of reduced hepatic, renal, or cardiac function, concomitant disease, or other drug therapy. During upward dose titration, watch carefully. The risk of both cardiac and cytotoxic side effects of Nabilone is increased in elderly patients. Children, infants, neonates. The safe and successful use of Lexacemet in neonates, babies, children, and adolescents younger than 18 years of age has not been identified, according to the manufacturer. However, the two trials comparing the antiemetic effects of Nabilone with other traditional antiemetic regimens in children have not been carried out. This knowledge is minimal due to its potential psychoactive effects. Caution is advised when prescribing Nabilone to children. Pregnancy. Nabilone is listed as a Category C FDA pregnancy risk. No sufficient and well-controlled studies of Nabilone in pregnant women have been conducted. Those relate to development toxicities that involve growth retardation and that have been shown in 2 animal studies. It is uncertain whether the placenta is caused by Nabilone to be the fetus. Due to the lack of data of pregnancy exposure to Nabilone and the likelihood of a significant risk of adverse reactions to the developing fetus, it is advisable to avoid using Nabilone throughout pregnancy. Only in the most refractory of patients who do not respond to or are unable to tolerate alternative antiemetics should the use of Nabilone to be considered. Breastfeeding. In breastfeeding mothers, Nabilone and other cannabinoids should be avoided due to potential for severe adverse reactions from Nabilone in breastfeeding children. Whether these metabolites are excreted in breast milk is unclear. Whether to avoid breastfeeding or to discontinue the medication should be determined, taking into account the value to the drug to the donor. Side and adverse effects. In the nervous system, drowsiness, vertigo, dizziness, ataxia, concentration difficulties, memory disturbance, convulsions, hyperactivity, nervousness, euphoria, sleep disturbance, hallucinations, panic disorder, anxiety, emotional disorder, paranoia, insomnia, mood swings, and tremor. In the gastrointestinal system, dry mouth, nausea, vomiting, diarrhea, abdominal pain, constipation, ulcer, mouth irritation, gastritis, dyspepsia, anorexia, and thick tongue. In the cardiovascular system, hypotension, tachycardia, palpitation, hypertension, arrhythmia, elevated supine and stunting heart rates. In the circulatory system, anemia and leukopenia. In the musculoskeletal system, muscle pain, neck pain, joint pain, and twitches. In the urinary system, increased urination, urinary retention, malnutrition, frequency, and impaired urination. In the respiratory system, dyspnea, pharyngitis, nasal congestion, sinus headache, dry throat, dry nose, sneezing, nosebleed, cough, and voice change. Some nursing interventions before administration of the drug. Evaluate vertigo or ataxia that can impact gait, balance, and other functional operations. Submit to the doctor and nursing staff coordination issues and functional disabilities, and caution the patient and family to protect against fall and trauma. Inform patients that if used with alcohol or other CNS depressants, medication can cause additive CNS depression. During, track behavioral and mood changes such as anxiety, euphoria, depression, disorientation, paranoia, memory lapses, decreased focus, paranoia, panic. Responses comparable to psychosis or other mental condition. Changes. If these changes become troublesome, alert the physicians. Evaluate heart rate, ECG, and heart sounds, especially during workouts. Report rapid heart rate and other arrhythmia symptoms, including palpitation, pain in the chest, shortness of breath, fainting, and fatigue or weakness. Periodic blood pressure measurement in relation to normal values. Low BP is reported, especially if there is dizziness, exhaustion, or other symptoms on the patient. Protects against falls and trauma caused by vertigo or ataxia. Introduce fall prevention techniques. Assess exercise tolerance regularly and instantly terminate exercise if there are any untoward responses. Ensure that the patient, particularly during initial usage and dosage changes, remains under the supervision of a responsible adult. After, to help document if drug therapy is effective, control enhancement in GI symptoms. Advise the patient on the possibility of sleepiness during the day and reduced concentration and mental focus in other tasks that require close focus. Stop driving and use caution. Educate the patient during excessive or extended use about the risk of physical and psychological dependence. Advise the patient to stick to the correct dosing schedule. Report annoying side effects such as extreme or persistent headache, nausea, increased appetite, or dry mouth to the patient. Tell patients, family members, or caregivers to report depression, suicidal thoughts, paranoid reactions, and other extreme CNS reactions.